Vitamin D is one of the most essential vitamins in the body. It's very important to get to with the bone metabolism, calcium metabolism in the body. It does require multiple organs to kind of make it, and then you need a lot of sun exposure. In our area, when we don't have too much sun and we don't have too much sun exposure, we end up having a lot of people having low vitamin D. I have been testing it for the last 3 years, and it's almost 90% of people have extremely low. And when we have vitamin D level low, it's difficult to fix because you need a large amount to fix it. So what we have available on the shelves in the pharmacies, mostly like 400, 600, 1,000, it can barely touch it. So vitamin D has to be tested, and after treatment has to be tested to make sure we have enough. And the side effect down the road, like if somebody doesn't have enough vitamin D and if they continue having low level all the time, in years they end up having osteoporosis, thinning of the bone. But of course it does take longer time. But why don't we do it now and help with the problem right now before it gets too late? Any primary care physician could test for the vitamin D, and we get the level, and based on what lab are the tests been done. Give you an example. The number of normal level 30 to 100, majority of people are 10, 12, 15. So taking 1,000 or 2,000 units a day is not enough. What the patient need, they need a prescription of vitamin D 50,000 strength a week at least, or like total a week 100,000. If somebody want to take and not want to be tested at all, and at least they have to take like 4,000 or 5,000 units a day. But it's in medicine, it's better to test the level of what you are lacking and then double check that this level is being corrected. Like when we treat diabetes, when we treat high blood pressure, we measure and we found the value. Is the problem corrected or not? Most people, when they correct the vitamin D, they will have more energy in the daytime. They lose weight. They have more concentration. Their overall health will become much better. And so should everybody take a big dose? Of course not. If you have a normal vitamin D level in your body, that's it. You don't need it. And that's another subject when we talk about supplements. A lot of people spend a lot of money on supplements. My approach to this is any supplement you take, including vitamin D or zinc, selenium, chromium, copper, whatever, why don't get the test done and be treated from that point?